When I went in to get my first ultrasound, we noticed that he wasn't as growing as big as he should be. I was so glad he was born. Because when they tell you all this stuff about having issues, you never know what's going to happen once they come out. I cried. Happy cries, not sad ones, but they were happy ones.
And then I helped them cut the cord and stuff. Well, then he went straight to the NICU after that.
So I first met Karter in the ICU soon after the delivery. He was born very small, IUGR. He had dysmorphic features. He had small head, microcephaly.
These are cases I sit up late at night and think about because I know they've been on this odyssey, they're trying to find an answer, they're trying to do the best that they can to take care of their child. So what I think is really fabulous about the team here at Mayo Clinic is we actually present each case to a genomic odyssey board, and it's comprised of the clinicians who care for the patient, the geneticists, the scientists, the genetic counselors. We usually even have ethics individuals there.
We are Sherlock Holmes of the geneticists, so to speak. And so we're trying any sort of technique, idea, data sleuthing we can to try to solve these cases. The DNA sequencing provided the variants we were suspicious about. The RNA sequencing was what allowed us to characterize those variants and show that they were pathogenic and really is what was causing the disease.
So using this information, we found he has a diagnosis of orofacial digital syndrome type 14. And actually at the time of testing for him, only one manuscript or only one paper had been published on this disorder, with only 3 cases ever described.
After establishing the diagnosis, if we know sufficient information about this condition, we can provide more detailed information to the family what the future holds.
I would say that Karter's case is a very exemplary case of something that's paving a road for many patients to come. We're able to pull together a lot of experts to talk about his case, understand what we think is going on, test him with these very powerful new techniques like exome sequencing and RNA sequencing, propose a potential pathogenic change that might be related to Karter's condition, and then use a new novel research method to actually prove that that's what's going on.
I want him to try and go to college. I want him to be as independent as possible.
I mean, I want him to ultimately just be happy.